back with Dr. Tural, a pediatrician. Dr. Tural, tell us a little bit about different stages of growing pains a mom can expect from the baby. You know, maybe there's something at 3 months where the baby has usually this type of symptom, something at 5 months, something at 2 years, something even at 14 years and 12 years. Take us through very fast without too much detail. We may go into detail later, but take us through some of those relatively known growing pains for different, for children, maybe boys and girls different, I don't know, as they kind of come in more or less a type of age range and what they present.
The growing pains are basically is a more significant problem on children, mostly 2 and up, 2 years and up. The younger ones, you can call it growing pains, but by definition, growing pains is where the cartilage growth plates on the long bones would hurt because they jump all day. And then the cartilage growth plates are designed for growth, not to take a beating. Like when they jump up and down, then that is the area. Typically, it is above and below the knee joint where there's growth plates, and then that's where they feel their pains. And then it typically comes at the end of the day, because that's when the time that they are now finally tired and ready to go to sleep, but the pain is now back full force, and then it doesn't allow them to fall asleep. So what a mother can do, or a parent can do, is massage that area. Massage that area, and then also sometimes an ibuprofen would take the pain away. And then that would be the most common reason and most common age that we see growing pains to affect the child. Of course, in the course of it never is between middle of their thigh or middle of their leg. It is always around the knee joint or hip area.
And are the children mentioning it? They say, "Mommy, it hurts here," and they point to it or something?
Right, yeah, they do. They do point to their knees in general. They don't point to their particular growth plate, obviously, because it's a dull pain. They can't feel it there. But when you rub and massage the area, then they would feel the comfort. And then the massaging does make it go away, because it probably brings a little better circulation to the area, and then also the massaging would keep the skin warm, and then that would help them to get comfortable and be able to fall asleep again.
And the other ones, as we advance, as we get older, 10, 12, 14, any other such stages?
Those stages, there's of course this time of rapid growth during adolescent growth spurt. That also is the time when the growing pains can return, because of the activity in those growth plates, and then the fast growth, and then the mechanics are the same. The same things apply. Motrin or ibuprofen is helpful to subdue the pain, and then also massaging, as I said, at which point the child that age can massage their own legs.
And do the pains appear in the same areas, or are they now coming up in different areas?
The growing pains would be in the same areas: the ankle, the knee joint, around the knee joint and hip region, and then there's the long bones have growth plates, so it could be in their arms and arms too. But the basically what goes into is the pressure bearing. Like the legs are bearing the entire body's weight and then gravity, but arms are not. Arms would be implied in kids who are involved in intensive sports. And then when they use their arms too much, then they can feel the impact of that in their joint growth plates, and then they could have experienced the pain. Other forms of pain are sometimes chest pains and what have you, but those are not growing pains.
Okay. All right. Well, wonderful. So basically, massage the area, tell the child this is part of what happens, or may as a 2-year-old probably will not understand that, know what it is. The child does not need a knee replacement when that happens at 2-year-old, right? Okay, that's good. That's good to know. Thanks a lot, Dr. Tural.